Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a this audio podcast is part of a Newspart Interlude. This audio podcast as part of a Ztorm and Squala, and this audio podcast as part of a Ztorm Robotics. This audio podcast is part of a Ztorm Robotics production. In this in this audio podcast. I look at a sort of a sort of a sort of a brief a sort of brief or quick overview in regard to the National Institute for Health Research, or NIHR's um, sort of a document in regard to the guidance on the use of social media, the guidance on the use of social media in context of healthcare services, research, and in regard to patient and public involvement, patient and public involvement. To inform this particular sort of document was originally launched after originally launched in following the NIHR's conference conference that took place in around 2014. As part of this interlude, this audio podcast and this Newspart interlude, I look at a little bit in regard to this particular guidance, on the use of social media in context of healthcare services and healthcare service research. So the guidance provides sort of examples of ways in which different types of social media are and have been sort of utilized to involve the public in research, the advantages, the challenges, the risks, the ethics. So ethics and the ethics of using social media for involvement, and some sort of tips and things to think about. The works the sort of advisory group originally compiled additional sort of reading, which can be identified through the end of the at the end of the at the end of the doc, at the end of the at the end of the at the end of the publication. The examples collected to complement this the document are listed within the document, but full details of each for each example, a summary of the research project, how members of the public were involved, challenges, resources used, the impact of using social media, and advice for others are also available through NIHR. Uh, in the document, the document covers sort of an intro, a look at sort of different definitions around healthcare research, aspects of healthcare research, how the guidance was developed, the types of social media being used or have been used in context of research, or in context of involvement and research. Examples of using social media to involve people in research, the advantages and challenges of utilizing social media, managing risks, ethics, aspects around ethics, what and aspects in around what is not known about utilizing social media to involve people, involve people in the public. Things to think about before utilizing social media. Some top tips, and some useful reading, and sort of a and 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 some aspects in regard to a jargon buster. So in regard to as part of this, just sort of a look at the as part of this interlude, a look at the intro of this particular NIHR document. So social media is or has been has been sort of well established, but its use as a way to involve uh, involve um, involve healthcare service users in research is sort of is relatively still relatively still relatively recent. So originally, and sort of additionally, listeners, that to inform that involvement works where healthcare services originally started out, and originally started out was in around 2007, and 2007, for example, where much of the focus had been in regard to involving healthcare service users in context of in around where healthcare service users are required, or have been required in context of particular where particular trialists or clinical trialists, for example, had sought to involve participants in across varying sort of diseases or conditions to sort of and see that a sort of where the aim and the objective would have been to sort of to better the lives of those suffering across different conditions and illnesses. However, where involvement was and had been in context of where trials are concerned, in around particular specific clinical trials, much of the involvement, or at least much of the involvement in around guidelines and practices around 2007 would have been where physicians and clinicians, for example, would have primarily focused on recipients or participants, or involvement in context of where there was an involvement more as a sort of tick box activity, rather than involvement in context of the guideline that had been launched shortly after the NIHR Involve 2014 conference. And so again, where social media has been now well established, but its use as a way to involve patients and the public in research, again, is and still of recent development. So in 2014, Involve brought a project advisory group together. An advisory group together to consider the opportunities and the challenges of using or utilizing social media, for example, to involve the public in research. The advisory group carried out a scoping activity to look at whether there was any existing guidance, and found a lot of information on the use of social media, for example. On the use of social media, for example, one-way sort of communication, where, for example, advertising an opportunity or raising awareness of research activities. However, there was little information or guidance on the use of social media in active public involvement. Therefore, the guidance or this guidance had focused on active public involvement, by which NIHR or NIHR involved had meant the use of social media as a way to involve people in priority setting, design and or conduct of research. Although its focus this focus is yeah, although this although the focus is and some the focus is and some where some of the examples also mention sort of the interplay and participation. The guidance may and can also be relevant and important to a sort of regarding activities. So this guidance, the guidance that NIHR the NIHR involve guidance in regard to use of social media to involve people in research is aimed primarily at researchers or investigators and others facilitating involvement in research. However, it may also be of intrigue to members of the public involved in research and others interested or intrigued in the use of social media to support public involvement. And so, looking at sort of some additional specifics. So people have defined social media in different ways, as a basis, the guidance looks at looks at the NIHR involved guidance looks at and in around communication among people with in amongst sort of virtual in context of virtual communities and networks. So, for example, Twitter, and or Facebook, for example. The definite the basis refers to some of the existing forms of social media in sort of in some of the existing forms of social media that are well known, but also where in and around the world of social media changes or has advanced and that sort of other platforms and ways of interacting within virtual virtual communities had also been part of the NIHR guidance and the although the document of the guidance is somewhat extensive. It is informative. It informs in regard to additionally as per mentioned in the context the sort of the look into how the guidance was developed and the types of social media in context of research or healthcare research and examples of using social media examples of using social media in context of healthcare research are pages within the NIHR involved document where pages are well informed and So, as part of this audio podcast, there'll be a list of sorry a link to the a link to the applicable document, and at the end of the document, additionally, there is a list of useful or helpful useful reading or additional reading, if listeners are interested are intrigued to find out more about the use of social media in context of healthcare research or healthcare service research, for example, and so that draws this audio podcast to a close. This audio podcast as part of a Newspart interlude. This audio podcast as part of a Ztorm and Squala, and this audio podcast as part of a this audio podcast as part of a Storm Robotics production.